Good afternoon. I'm honored to speak with you today in this 18th year of BioAsia and to lead off the very distinguished panel gathered here virtually for a discussion of the lessons to be gleaned from the COVID-19 pandemic. One lesson, a welcome one, is that India has emerged as a leader in the global fight against COVID-19 because of its great capacity for manufacturing vaccines and its expanding capacity for developing them too. India makes 60% of all vaccines, 70% for LMICs with UNICEF and Gavi support. India has made great advances in vaccine development, and BMGF has been pleased to collaborate with Serum Institute of India, Bharat Biotech, and BioE, some of your great companies. Through Gavi, Bill and Melinda Gates Foundation has provided funding to enable Serum Institute to accelerate manufacturing of up to 200 million doses of safe and effective COVID-19 vaccines for lower middle-income countries at less than $3 per dose. Our foundation also provided funding to BioE to accelerate manufacturing of up to 100 million doses. In collaboration with the Indian Council of Medical Research, Bharat is developing Covaxin, India's first indigenous COVID-19 vaccine. Bharat is also working on BBV154, a non-invasive, needle-free, intranasal COVID-19 vaccine. That would be a huge advance. Another positive development has been the global leadership demonstrated by India's government. The Vaccine Made Free, or Vaccine Friendship Initiative, has leveraged India's manufacturing capacity to put the nation at the forefront of distribution of COVID-19 vaccines to countries around the world. This will be crucial in equitable distribution of COVID-19 to lower and middle income countries. Through Serum Institute, India has supplied 16.7 million doses of the Oxford AstraZeneca vaccine to 20 countries as it vaccinates its own population. The Indian government has also cleared supply of 34.5 million doses of COVID-19 vaccines to 25 countries on a commercial basis. Also, India has agreed to supply 10 million vaccine doses to Africa and 1 million to the United Nations healthcare workers under the COVAX facility coordinated by the World Health Organization and Gavi. India's strong commitment to R&D has also put it at the forefront of the fight against COVID-19. The foundation provided support to government entities, including the Department of Biotechnology, the Indian Council of Medical Research, NITI Aayog, the Office of the Principal Scientific Advisor, and state governments. The Department of Biotechnology's Pan-India 1000 SARS-CoV-2 RNA genome sequencing program, launched in May last year, has played a crucial role in development of diagnostic testing kit validation and antiviral testing, as well as in identifying new strains of the virus. In terms of misses, the pandemic has exposed major weaknesses, global ones, of long-standing inequities. These are evident in the pandemic's impact: greater than 2 million lives lost, 100 million sickened, lost school class time for 1.5 billion children at least, and a global recession. In lower middle-income countries, the pandemic has increased poverty, strained health systems, potentially setting back progress against potential killers such as HIV, TB, and malaria. While the COVAX facility has been a shining example of international cooperation, global vaccine equity has not been achieved. COVID-19 vaccine export controls, bidding wars, go-it-alone vaccine development in many developed countries. This highlights the value of India's strong pharma sector and its focus on serving the world. We hope that other regions, such as Africa, are also able to develop vaccine manufacturing platforms to form a global network of regional manufacturers. Despite lapses in international cooperation, the pandemic demonstrates that all health is global. No country is safe unless all are safe. The virus thriving anywhere in the world makes the emergence of new variants inevitable. For example, it may not be entirely coincidental that an early COVID variant took hold in South Africa, which has the world's biggest HIV epidemic with greater than 20% of the population infected. Lots of people in South Africa, even those on antivirals, are immunosuppressed. Many individuals can be chronically infected with COVID, and even a single individual can generate dangerous variants. Lower middle income countries often lack the resources needed for effective disease surveillance, which makes it harder to see and to know what pathogens are circulating. This in turn makes it more likely that pathogens will spread unimpeded to other geographies. South Africa has a relatively strong pathogen surveillance system, which in part is why they identified the B1351 variant there first. India's growing capacity for sequencing and its innovation in vaccines might be invaluable in helping counter the emergence of these variants. In short, global health security depends on reducing the burden of infectious disease and strengthening health systems in every corner of the globe. This is the most important lesson of the current pandemic, and as we look beyond it, this is the major challenge that faces us. What we should aim for is a new normal, a re-energized global health ecosystem, not a return to the state of the world in February 2020. The pandemic has led to previously unimaginable scientific and technological innovation, public and private collaborations, and behavior change on a global scale. How can the urgency around COVID-19 be extended to other long-standing diseases, the silent epidemics? Potentially productive opportunities include accelerated vaccine manufacturing. Hexapro is a new version of the spike protein designed by University of Texas scientists, and this could enable much faster and more stable production of vaccines worldwide. Hexapro produces up to 10 times more protein than that of an earlier synthetic spike protein already in use in multiple COVID-19 vaccines, and we'd love to see this widely deployed. Globally connected systems for disease detection. Next generation sequencing has become widely available in lower middle income countries, and next generation sequencing data stored securely in a global cloud with open source bioinformatics and workflows could be used for local interpretation of findings, which could also help with early detection of future pandemics. The digital frameworks for diagnostics currently existing and utilized to manage testing and delivery of results via smartphones, well, these systems have the potential to incorporate geolocation and centralized data aggregation to improve disease detection and predictive capabilities. The global community can begin to work to define the necessary norms, specifications, and processes to implement this technology widely and increase its use in lower middle income countries. India has enormous potential to make major contributions to global health. In addition to its strengths in biotechnology and pharmaceutical manufacturing, I'll mention two areas where India has great opportunities. In digital health, India's National Digital Health Mission is a crucial step towards strengthening health systems and ensuring efficiency and transparency in access to healthcare. In artificial intelligence, AI holds immense promise to strengthen diagnostics, surveillance systems, and rapid development of therapies. AI will be crucial in strengthening our public health systems to effectively manage future challenges like COVID-19. An example is the testing tool for COVID-19 developed by Wadhwani Institute, which uses artificial intelligence to screen for COVID-19 based cough sounds. This non-invasive testing tool holds significant potential for scaling up testing capacities and for use in identifying other diseases that impact the lungs, most importantly from our perspective, tuberculosis.